India's coronavirus toll crossed the 3 million mark over the weekend, and while all this has been going on, Indian cities have almost returned to normal. In the next few minutes of Backtrack, we'll look at the reasons behind this contradiction and whether the return to normal is based on reason or complacency. In terms of total cases, India is just behind the United States and Brazil, with cases amounting to 31 lakh. Till date, over 57,000 people have succumbed to the virus. The government has attempted to pass off the rising numbers as routine and is playing down the numbers of deaths, which have also steadily grown. Karnataka, for instance, has been reporting more than 6,000 new cases every day for the past 1 week. Since the start of the COVID-19 surge on June 21st, there has been a 750% increase in the number of statewide deaths up to August 2nd, although numbers may be higher in subsequent days because the data is still out. According to a report released by the BBMP, the moving growth rate for new cases and deaths has been decreasing. The moving growth rate for active cases in Karnataka has fallen from 725% on 18 July to 118% on August 8th. The state capital Bengaluru has seen a far drastic decline from 2,172% on July 4th to 50% on August 8th. The moving growth rate for fatalities in the state has dipped from 552% on July 18th to 148% on the 8th of August. In Bengaluru, it has dipped from a peak of 651% to 93% in the same period. The moving growth rate is used by epidemiologists to look at the larger trend of the pandemic. The main purpose is to smooth out everyday fluctuations, but what do these numbers really mean? If you were to plot the number of active cases in Bengaluru for this period, you will see that between July 4th and mid-August, the number of cases rises exponentially. While epidemiologists use the moving growth rate to analyze a long-term trend or cycle of a disease outbreak, the findings can present a less than accurate picture of the current ground realities. This is because the moving growth rate considers the number of new cases or deaths in the first week and the fourth week. For example, while a sudden surge in cases could see the percentage chart line skyrocket upwards, a moderate decrease over the next 30 days could come off as a significant drop in MGR calculations, when the end percentage itself is still significantly high. All most people see at the end of all this is a drop in the charts, which always looks like good news, even though it actually may not be. Meanwhile, the nation's recovery rate has crossed 75%. But this number is meaningless without considering what makes a COVID-positive patient to be declared COVID negative, especially when we are still unaware of long-term consequences of the infection. In Karnataka specifically, the discharge policy of the government may also have contributed to the idea that everything is under control. Until June this year, a COVID-19 patient had to undergo a test to confirm recovery before being discharged. The discharge policy was modified on June 23rd, making it unnecessary to get a repeat test. The government has justified this, citing recent research which says that once the symptoms are gone, the patient may test positive, but is less likely to be infectious. It is important to note that the experts have been wrong before, especially when it comes to the role of asymptomatic patients in spreading the virus. So it is unclear whether the state's high number of daily discharges have some validity or if they are measured to maintain an underlying percentage of free beds. The calculation of data comes down to the most crucial part of the story. The policy changes regarding testing. The widespread deployment of antigen testing may also have been giving a false picture of the crisis. Antigen testing is known to give many false negatives, resulting in many people slipping through the cracks. To understand the antigen testing and how it is being used in the state, you can click on the link in the description. It will also tell you why we may have to look at the resulting data skeptically. Amid all this, there is a new problem that's brewing among the common people. Many symptomatic patients are scared of testing positive and being forced into hospitals, which would result in them incurring a financial burden. The BBMP has also been receiving complaints against certain private healthcare providers who have been accused of forcing asymptomatic COVID patients, plus those isolating at home, into institutional hospitalization in order to generate revenue. In our previous video, Pandemic in a Metropolis, we spoke about when it can be said that a pandemic has ended. 1, if a COVID vaccine is found. 2, if people collectively decide to move on from the crisis. It seems that given these factors, from incomplete data sharing to the lack of trust on healthcare providers, the people seem to have chosen to move on. With an oxygen crisis looming over our heads, will such a complacency be the undoing of the work till now? That is something time will have to tell.